In this presentation, I will be going over a rare disease known as Gaucher disease. The following sections will include history, etiology, disease process, various types of disease, symptoms, diagnostic testing, treatment options, and the prognosis. Gaucher disease affects only about 1 in 50,000 to 1 in 100,000 people worldwide. Gaucher disease occurs more frequently in people of Eastern and Central European Jewish descent than those of any other background, affecting 1 in 400 to 1 in 600. Gaucher disease was first noted by Philippe Gaucher in his doctoral thesis in 1882, when during a post-mortem exam he noticed the infiltration of enlarged cells in a spleen that represented a neoplasm. The biochemical basis for the disease was explained in 1965 by Dr. Roscoe Brady of the NHI, when Brady identified the metabolic defect in a lipid storage for the disorder of Gaucher disease. In 1967, he helped the development of the diagnostic test for the disease to measure the activity of the enzyme glucocerebrosidase in the white blood cell. In 1987, the first gene mutation that causes Gaucher disease was discovered by Dr. Shoji Tujai and his co-workers. This is a picture of Dr. Philippe Gaucher. Etiology. Gaucher disease is an autosomal recessive genetic disease that must be inherited. On the right, you will see a chart of autosomal recessive inheritance as it affects the parents to the offspring. Disease process. Glucocerebrosidase, also known as GBA, functions of the normal individual. In a normal individual, the GBA gene makes up an enzyme called beta-glucocerebrosidase, which this enzyme is active in liposomes, therefore helping break down glucocerebroside. The glucocerebroside produces the normal cell function. In a person with Gaucher disease, the GBA gene is deficient in cell production, causing a decrease in the liposome enzyme. Therefore, accumulation of cerebroside takes place, resulting in the enlargement of organs and tissues. On the left, we have a view of bone marrow cell of a healthy individual, and on the right, you have a bone marrow cell of a person with Gaucher disease. The difference between the left and right is very noticeable within the two slides. Types of Gaucher cells. Type 1 is the most common type and affects tissues and organs, affecting young children and young adults. Type 2 is a very rare, usually resulting in infant death, affects tissues and organs including the nervous system and brain, and affects infants. Type 3 affects the tissues and organs including the nervous system and brain, affects young adults and older adults, and progresses more slowly than type 2. Here I have included a chart of the multi-system involvement in type 1 of Gaucher disease. These conditions can manifest at any age throughout the disease process. This chart gives an overview of the neurological manifestations that transpire from birth to later adulthood for individuals affected by type 2 and type 3 of Gaucher disease. Symptoms. Common symptoms are lung, kidney, and digestive problems, bone problems, including growth retardation in children, joint pain, fractures, and acute bone crises, blood-related problems that include nosebleeds, bruising, anemia, and then general fatigue. Severe and less common symptoms of type 2 and type 3 are central nervous system complications that include seizures, dementia, abnormal eye movement, and cognitive impairment, just to name a few. Diagnostic testing. Enzyme testing measures glucocerebrosidase activity in the blood or urine. MRIs show the extent of the disease by looking for enlargement of the organs. CT scans can sometimes show the damage the disease has caused to the bone and tissue. Quantitative chemical shift imaging evaluates the extent of the bone marrow involvement and disease severity. Dural energy X-ray ophthalmometry measures the bone density in genetic testing to determine the types of Gaucher disease. Treatment options. Treatment options are only available for type 1 of the disease and include enzyme replacement therapy that is designed to replace missing glucocerebrosidase cells by infusion, substrate reduction therapy that reduces the production of glucocerebroside within the cells. Prognosis. Gaucher is a progressive disease. Type 1, the general prognosis is good if caught early due to the availability of treatment options. Type 2 and 3, the most prevailing outcome is death due to there being no treatment options or known cure for the disease. Type 2 usually causes life-threatening medical problems due to the nervous system breakdown, which begins in infancy, resulting in death by age 2. Type 3 also affects the central nervous system but progresses more slowly than Type 2, and the effects can last to young adulthood or early adulthood before death.